Hey again, one more video tonight. This one might be a little bit too basic for some people, but I didn't really trust the training as I saw it. So I wanted to go over the clinic note so everybody understands what the point was. If you can look at it and just kind of figure it out, that's fine. But again, we have an open encounter here. We are going to open our clinic note, which we can do right here with the button. Or if you don't have that, you just create a note if it's not already there. And the smart phrase, the dot phrase, is dot tent. Um, and then it should pull up the tent clinic. And, oh, I'm sorry. My bad. It's the smart text. Those things that I told you only I can make. Um, or a smart builder can make, not just me, but a builder. Uh, so that's the note there. We showed in another video how to make these buttons if you haven't seen it. So try to make that bigger, big as it will go. Okay, so this clinic note, I'm going to run through it really quick. Obviously, the wild card here um, is just something to force you to put something in the history. You can use anything, any extra tool here. Dictation would work well. Uh, commands with your dragon, or additional smart phrases that you make yourself. All of this here will be auto-populated through either prior data that Stormont already has, or if it's a new patient that the text have entered in here. You'll notice that it's relatively brief. It does not contain review systems. The social history is just tobacco, and the vitals is just the weight. Trying to cut down on note bloat that we don't need for coding purposes anymore. When somebody besides when it's closed and signed, all of these sections here will be collapsed. Um, the next component is physical exam. So there's a lot of options on physical exam. First thing I would say, from the very beginning, if you don't want to use this little drop down list, you don't have to. Just put the cursor there. And if you have a dragon command already made, let's say exam ear, you can just do that. This box won't show up um, it, if you don't put anything in it. If you do want to use the boxes, there's two different ways to do that. So first one is note writer. You're not going to want to do that at first because it takes work, some work to make it good. This list is what you would want to use. So if you click that and then hit return, you'll get different choices. Detailed is the typical one that we use in Mac practice. I might have changed a little bit. And then ear doesn't have, let's say, the oral cavity exam, the nose exam, um, et cetera, because we don't need it um, for any sort of coding purpose, as long as CMS just kind of says whatever is needed, whatever is relevant. So if you hit detailed here and hit return, you'll get your normal exam drop in, and then you'll just have to go and change it. Uh, your other option, I will show it to you very quickly. That obviously disappears, by the way. You figured that out, so you have to re-enter it. So we'll open that note again. So physical exam, this thing called Note Writer. If you hit that and hit return, it's going to insert this thing called a smart block. Then you have to select it and hit edit. That's going to bring over this whole big mess of stuff. So within this, you have all these different check boxes and things. As you can imagine, that is not going to be very uh, time friendly if you were to try to check all of these boxes and nose and everything. Where it's useful, show you how it works. You may have seen it before, but say there's patent. Uh, there's erythema on that side. There's edema on that side. There's a thing screwed up there. No. Um, there's a septal deviation. Um, there's no uh, septal vessel. You can see it's inserting these things. So you can pick all of these things and make it exactly how you want. You can type in comments and all of these things. And then you can go up here. I think it's this button. Yeah. So you can hit create macro from current data. Um, if you put that in, you can name it. And I guess I can just do that. And you hit accept. My screen is really small how I have it in my computer, but you'll see that that test thing pops up. That's permanent. And the next time you go to NoteWriter, you can hit test, and it will insert that exam. So you could imagine having a tube check one and those sorts of things. So that's how it works. A little clunky, but that's how it works. So next thing is the data review. We have this on our Mac practice form. It's the same idea. You just hit the boxes, hit return, and then you can check what you did. So you reviewed external notes, you looked at a stroboscopy, uh, you did a stroboscopy, and then you hit return. Then you have to answer, okay, well, who did you talk to? Well, or which notes did you read? I read primary care and I read endocrinology. And then you hit recurrent return and you're done. Um, and then this test results is not necessarily a part of the data review for coding, but it will pull in anything the patient has had that I have put in there. So thyroid is like um, TSH, and parathyroid is like PTH, maxillofacial CT, those sorts of things. You'll have to play with it, but it pulls in like on the sinus CT, it pulls in the impression. On the thyroid, it pulls in the last TSH. Parathyroid, you just have to play with it. It's okay. It's nothing outstanding. And then this was covered in another thing. CT indications, again, that's just for if you're worried about you have to do a prior auth for somebody that's a pain like Ambetter or whatever, you can just hit it and hit return, and that'll insert the things that at least the NIA requires, which is not always what every insurance requires. And then the consent, lastly, if you set up a surgery, it's a rather extensive um, consent list. You can see all these things. So PE tubes, and you can select as many as you want. And when you return, you have to answer whatever little questions they are, whether it's bilateral or whatever. And you can see now that these suckers are long. Um, you can ask, if you don't already know, ask Macklin why they're long. Um, so that's the basic form. I'm going to have another video on how to do smart phrases so people can get started making those. Probably all the surgeons already know how to do that. Have a good evening.